But there are ways to boost how you feel and make your senior years healthy and happy. Are you an older adult with depression? Have you lost interest in the activities you used to enjoy? Do you struggle with feelings of helplessness and hopelessness? Are you finding it harder and harder to get through the day? If so, you're not alone. Depression can happen to any of us as we age, regardless of our background or achievements. And the symptoms of elderly depression can affect every aspect of your life, impacting your energy, appetite, sleep, and interest in work, hobbies, and relationships. Unfortunately, all too many depressed older adults fail to recognize the symptoms of depression or don't take the steps to get the help they need. There are many reasons why elderly depression is so often overlooked. You may assume you have good reason to be down or that depression is just part of aging. You may be isolated, which in itself can lead to depression, with few around to notice your distress. You may not realize that your physical complaints are signs of depression. You may be reluctant to talk about your feelings or ask for help. It's important to realize that depression isn't an inevitable part of getting older, nor is it a sign of weakness or a character flaw. It can happen to anyone, at any age, no matter your background or your previous accomplishments in life. While life changes as you age, such as retirement, the death of loved ones, declining health, can sometimes trigger depression, they don't have to keep you down. No matter what challenges you face as you age, there are steps you can take to feel happy and hopeful once again and enjoy your golden years. Depressed older adults may not feel sad. While depression and sadness might seem to go hand in hand, many depressed seniors claim not to feel sad at all. They may complain, instead, of low motivation, a lack of energy, or physical problems. In fact, physical complaints, such as arthritis, pain, or worsening headaches, are often the predominant symptom of depression in the elderly. Causes of depression in older adults. As we grow older, we often face significant life changes that can increase the risk for depression. These can include health problems, illness and disability, chronic or severe pain, cognitive decline, damage to your body image due to surgery or sickness can all be contributors to depression. Loneliness and isolation. Factors such as living alone, a dwindling social circle due to deaths or relocation, decreased mobility due to illness or a loss of driving privileges can trigger depression. Reduced sense of purpose. Retirement can bring with it a loss of identity, status, self-confidence, and financial security and increase the risk of depression. Physical limitations on activities you used to enjoy can also impact your sense of purpose. Fears. These include the fear of death or dying as well as anxiety over financial problems or health issues. Recent bereavements. The death of friends, family members, and pets, or the loss of a spouse or partner are common causes of depression in older adults. Medical conditions that can cause elderly depression. It's important to be aware that medical problems can cause depression in older adults and the elderly, either directly or as a psychological reaction to the illness. Any chronic medical condition, particularly if it is painful, disabling, or life-threatening, can lead to depression or make your depression symptoms worse. Elderly depression is a side effect of medication. Symptoms of depression can also occur as a side effect of many commonly prescribed drugs. You're particularly at risk if you're taking multiple medications. While the mood-related side effects of prescription medication can affect anyone, older adults are more sensitive because, as we age, our bodies become less efficient at metabolizing and processing drugs. If you feel depressed after starting a new medication, talk to your doctor. You may be able to lower your dose or switch to another medication that doesn't impact your mood. Dementia versus depression. Never assume that a loss of mental sharpness is just a normal sign of old age. It could be a sign of either depression or dementia, both of which are common in older adults. Depression and dementia share many similar symptoms, including memory problems, sluggish speech and movements, and low motivation, so it can be difficult to tell the two apart. Whether cognitive decline is caused by dementia or depression it's important to see a doctor right away. If it's depression, memory, concentration, and energy will bounce back with treatment. Treatment for dementia will also improve your quality of life. And in some types of dementia, symptoms can be reversed, halted, or slowed. Self-help for elderly depression. It's a myth to think that after a certain age older adults can't learn new skills, try new activities, or make fresh lifestyle changes. The truth is that the human brain never stops changing, so as an older adult, you're just as capable as a young person of learning new things and adapting to new ideas that can help you recover from depression. Overcoming depression involves finding new things you enjoy, learning to adapt to change, staying physically and socially active, and feeling connected to your community and loved ones. And of course, when you're depressed, taking action and putting self-help steps into action can be hard. Sometimes, just thinking about the things you should do to feel better can seem overwhelming. But small steps can make a big difference to how you feel. Taking a short walk, for example, is something you can do right now, and it can boost your mood for the next 2 hours. By taking small steps day by day, your depression symptoms will ease, and you'll find yourself feeling more energetic and hopeful again. Self-help tip 1: reach out and stay connected. If you're depressed, you may not want to do anything or see anybody. But isolation only makes depression worse. On your own, it can be difficult to maintain perspective and sustain the effort required to beat depression. That's why support matters, so make an effort to connect to others and limit the time you're alone. If you can't get out to socialize, invite loved ones to visit you, or keep in touch over the phone or email. But remember, digital communication isn't a replacement for face-to-face contact. Do your best to see people in person on a daily basis. Your mood will thank you. And remember, it's never too late to build new friendships. Get out into the world. Try not to stay cooped up at home all day. Go to the park, take a trip to the hairdresser, have lunch with a friend, visit a museum, or go to a concert or a play. Volunteer your time. Helping others is one of the best ways to feel better about yourself and expand your social network. Join a depression support group. Being with others facing the same problems can help reduce your sense of isolation. It can also be inspiring to hear how others cope with depression. Take care of a pet. A pet can keep you company, and walking a dog, for example, can be good exercise for you and a great way to meet people. Dog owners love to chat while their pets play together. Take a class or join a club to meet like-minded people. Try joining a senior center, a book club, or another group of people with similar interests. Create opportunities to laugh. Laughter provides a mood boost, so swap humorous stories and jokes with your loved ones, watch a comedy, or read a funny book. Tip 2: find meaning and purpose in life. To overcome depression and stop it coming back, it's important to continue to feel engaged and enjoy a strong purpose in life. As we age, life changes and you can lose things that previously occupied your time and gave life its meaning. Retirement, the loss of close friends or loved ones, relocating away from your social network, and changes in your finances, status, or physical health can impact your mood, confidence, and sense of self-worth. But there are still plenty of ways you can find new meaning in life and continue to feel engaged in the world. Sometimes it's just a matter of reframing how you think of yourself or the aging process. Focus on what you can still do, not what you used to be able to do. Maybe you feel frustrated that you're not able to do everything you once could, or at least not to the same levels. Or perhaps negative ideas about growing older have dented your self-confidence. Instead of focusing on what you once did, try focusing on the things you can do. You'll see just how much you still have to offer. Learn a new skill. Pick something that you've always wanted to learn, or that sparks your imagination and creativity, a musical instrument, a foreign language, or a new game or sport, for example. Learning new activities not only adds meaning and joy to life, but can also help to maintain your brain health and prevent mental decline. Get involved in your community. Try attending a local event, tutoring kids, or volunteering for a cause that's important to you. Community work can be a great way of utilizing and passing on the skills you honed in your career without the commitment or stress of regular employment. Take pride in your appearance. When you retire, it's easy to let yourself go a little now you don't have to be at work every day. But putting effort into how you look each morning can give your self-confidence a welcome boost and improve how you feel. Travel. Once you're retired and your kids have left home, you likely have more time on your hands to visit the places you've always wanted to go. Book a vacation to somewhere new or take a weekend trip to a favorite place. Travel doesn't have to be extravagant or expensive to boost your mood. Enjoy time in nature by taking a scenic walk or hike, going fishing or camping, or spending a day at the beach. Write your memoirs, learn to paint, or take up a new craft. Everyone has different idea about what brings meaning and purpose to life. The important thing is to find activities that are both meaningful and enjoyable for you. The more you nourish your spirit, the better you'll feel. Tip 3. Adopt healthy habits. When you're depressed, it can be hard to find the motivation to do anything, let alone look after your health. But your health habits have an impact on depression symptoms. The better care you take of your body, the better you'll feel. Move your body. Exercise is a powerful depression treatment. In fact, research suggests it can be just as effective as antidepressants. And you don't have to suffer through a rigorous workout to reap the benefits. Take a short walk now and see how much better you feel. Anything that gets you up and moving helps. Look for small ways to add more movement to your day. Park farther from the store, take the stairs, do light housework or gardening. It all adds up. Even if you're ill, frail, or disabled, there are many safe exercises you can do to build your strength and boost your mood, even from a chair or wheelchair. Just listen to your body and back off if you're in pain. Eat to support your mood. Adjusting your dietary habits as an older adult can help you deal with the symptoms of depression. Start by minimizing sugar and refined carbs. Sugary and starchy comfort foods can give you a quick boost, but you pay for it later when your blood sugar crashes. Instead, focus on quality protein, complex carbs, and healthy fats, which will leave you satisfied and emotionally balanced. Going too long without eating can also worsen your mood, making you tired and irritable, so do your best to eat something at least every 3 to 4 hours. Support quality sleep. Many older adults struggle with sleep problems, particularly insomnia. But lack of sleep makes depression worse. Aim for somewhere between 7 to 9 hours of sleep each night. You can help yourself get better quality sleep by avoiding alcohol and caffeine, keeping a regular sleep-wake schedule, and making sure your bedroom is dark, quiet, and cool. Spend time in sunlight. Sunlight can help boost serotonin levels, improve your mood, and cope with seasonal affective disorder SAD. Whenever possible, get outside during daylight hours and expose yourself to the sun for at least 15 minutes a day. Have your coffee outside or by a window, enjoy an alfresco meal, or spend time gardening. Exercise outside by hiking, walking in a local park, or playing golf with a friend. If you live somewhere with little winter